In 2015, I wrote a book entitled Aging, Taking a Proactive Approach. That book is still available in paperback wherever you purchase your books. But in that book, I mentioned how in 2030 that we are expecting to have more aging population than 30-year-olds. Since that new data has emerged, and the new data stated that by 2025, the Census Bureau projects that the number of seniors is expected to surpass the number of children 13 and under for the first time. All of the nation's 74 million baby boomers will be 65 years or older by the year 2030. More people now than ever is expected to age in place, fostered by the recent pandemic, forcing people to not be able to go into skilled nursing facilities or not preferring to go into skilled nursing facilities. With that in mind, healthcare and home care solutions need to be adapted to fit those needs. And as you may or may not be aware, Retina Health Healthcare Services and Training Center, I am a licensed medical supplier as well as a licensed respiratory care practitioner. And so we do offer those services with the medical assistive devices needed for the home as well as home care. Some of the reasons that seniors give for wanting to age in place is that seniors value their independence. Most seniors want to stay in the home that they are familiar with around family and friends. They also feel as if having to move away and lose some of their property to go to a skilled nursing facility causes anxiety and stress, as well as putting an additional burden on their family members when their family has to travel to those skilled nursing facilities to visit them. Also, being able to age in place preserves a level of dignity. Loved ones can stay at their home and they can avoid the high costs associated with finding a healthcare facility. With the advancement in technology, home can become the new hospital, making it easier to age in place. I recently participated in a panel as an expert. I was asked to speak as an expert in reference to home health care. And one of the topics that I mentioned while during this panel was the fact that once upon a time, when we use assistive medical assistive devices, we had the capability to download the information, such as an overnight pulse oximetry, an overnight in-home sleep study, or in-center sleep study, or other devices, such as CPAP. Nowadays, we can monitor those things in real time. So once upon a time when we asked you to wear an overnight pulse oximetry, the next morning you were to either return it to the center or we would come to the home and pick it up. And then we would download the information, analyze it, read it, and give a diagnosis. Now with the advancement in technology, we can look at those things in real time. We can monitor your oxygen in real time as if you were in the hospital. We can monitor whether or not you're wearing your CPAP appropriately and getting the proper response in real time. So with the advancement in technology, it's making it more easy for seniors to be. So remote patient monitoring, it can improve aging in place tremendously, because now when not only is care getting to the patient faster, because now the patient doesn't have just to say, I have a symptom, I need to make a doctor's appointment, now I need to go to the hospital, then they need to test me to find out what's wrong, then they'll give me a diagnosis, and then they will create a care plan and do a treatment. With remote patient monitoring, when the physician or the care team can see the results in real time, they can make adjustment and changes as needed, keeping the patient out of the hospital, which once again will improve patient outcomes. Yes. I hope that you have enjoyed this short presentation about aging in place. Just remember that patient remote monitoring is something that you can discuss with your family members and with the family members of the patients that you care for to ease their minds and concerns that they may have by having a senior left in the home. Let them know that we have technology now that can take the burden away from them and the worry away from them, that their family member one is safe and that the home can become the new hospital. Thank you, and I hope that you have enjoyed this presentation from Retina Health Healthcare Services and Training Center. Just remember to check out my publication, my books, wherever you purchase your books. Book entitled Aging in Place, Taking a Proactive Approach. Thank you.